talking about the journey after having a joint replacement. Joining us via Zoom is Dr. Mark Kelley, an orthopedic surgeon with Aspirus Medical. Dr. Kelley, how common is it that people need this kind of surgery?
In this day and age, with the population, number one, aging, but also people have accumulated a lot of trauma over the years from sports participation and accidents. We're seeing a growth in joint replacement, particularly hip, knee, and shoulder replacements.
At what age range do you typically see patients in need of a joint replacement?
The vast majority of people are in over 60. However, there are, again, traumatic injuries, sometimes rheumatoid or inflammatory arthritic conditions that we see that need joint replacements because of wear and tear and a lot of issues with the joints themselves. But in typical fashion, it's usually in the 65 to, there is really no outer age limit. We want to maintain quality of life and keep people at home.
What does recovery look like after this procedure?
Well, we were very focused on pain management and trying to control pain because these are big operations. We've gotten a lot better at that. We deal with the pain before the surgery and then right through the process of surgery and then after. We've got a really nice program, I think, here that I've adapted from my years down in different hospitals, bigger hospitals, and then some people are actively studying this, so we follow the literature. Recovery is generally, if some people, I tell people, come in, we're going to have you turn yourself over to us for about 3 hours. We're going to do our work with our team, with our preoperative and perioperative team and our anesthesia folks. Work for about 3 hours, and then it's time to get up and get moving. So pain management is critical because we know that moving after surgery is really one of the best preventions of complications. Complications being blood clots particularly, and we know that you have to move.
How can patients manage their pain while recovering?
Well, we have a whole program. It's based on what's called multimodal pain management. Multimodal means there's different ways that pain manifests. There's inflammation, there's the nerve pain that comes from the surgery, and then there's the pain, the brain perceives pain both in conscious pain and subconscious pain. So we direct our treatments at all of that. We start before the surgery. As I said, we give people anti-inflammatories and some nerve agent before surgery, and sometimes occasionally, some steroid medicine before surgery and some intravenous Tylenol. We do our surgeries generally with a spinal anesthetic and then a sleeping medicine, but you don't need a huge general anesthetic, so we try and avoid the lung issues with the anesthesia gases, and that gives pain relief after surgery, so people wake up. That will last about 3 or 4 hours, and we put a block in the knee or the hip as we're operating and as we're finishing. That's a 2 to 3 day numbing medicine so that we can get people up and move them right away. Again, critical factor to be able to move. We use a lot of ice machines. Everybody gets a machine that they can take home and utilize. And then there's the oral pain medicine where we just create a base pain medicine with regular Tylenol regularly, some anti-inflammatory regularly. In non-diabetic patients, we use a little low-dose prednisone. And then we use narcotic pain medicine and a non-narcotic pain medicine. And I think one of the biggest fears patients have is the narcotics and the fear that they're going to get addicted to a narcotic through this. And that generally does not happen, and we talk about all of that, and we try and really allay the fears of people. And I spend a lot of time talking about one of those processes with pain is the psychology of pain, because nobody wants pain, and so people get afraid of pain, and I try and reassure them that's what we're all about, is managing this without having people have to go through this writhing in pain kind of a process.
Is there anything else you'd like to add?
I think here at Aspirus Medical, we've really developed a great process for joint replacement here in the community. People can stay locally and have the advantages of the bigger hospital techniques in a smaller hospital setting. And we have a wonderful team all the way from my great office staff through our schedulers and the perioperative care, the anesthesia, and then our recovery room and floor, we've just got a really nice system that works, and it's reproducible. So I can sit in the office and say, this is what's going to happen, this is how it should go, and this is what your outcome is going to be. And more often, very, very frequently, that's exactly what happens. And again, I think there's a lot of happy people in the community that are walking around with new joints that are quality of life is improved, their happiness and safety is improved. And I think a lot of people will say, I wish I wouldn't have waited so long. And that's probably the number one thing I hear at about 6 weeks after surgery.
Thank you, Dr. Kelley. We will have all that information for you on our website, myupnow.com. Stay with us, and we'll be right back after the break.